on all first downs and touchdowns. We were comparing it to a football game. Then when my surgeon walked in the room, the first thing that he said was, yes, it's a 13-hour operation, but it's not really 13 hours. It's like the Super Bowl. You have the pregame, you have the postgame, the actual operation is in 13 hours. So it's just really interesting to us that I don't know what tuned him into making a football analogy, but then he made that football analogy right after we had been talking about football and comparing it to a football game. What the doctor didn't mention, and I'm not sure if he knew or really realized this, but when I was 7 years old, I had open heart surgery. So, picture a 7-year-old kid and having open heart surgery, incredibly scary. And, I remember sitting in my hospital room every morning before it's light out, kind of like this, waiting for my parents to come. And this is, again, when I was 7 years old. So that whole experience set me up for a lifetime of fear of needles, fear of doctors, fear of anything medical. One time I was getting one of my routine stress tests on a treadmill. So I remember my mom took me to the hospital to get this routine treadmill test done. And I was fine until they said they had to insert an IV because they had to do a different kind of test. As soon as I heard the words IV, I ran into the bathroom and hid until my mom came to get me. You guys, I was 21 when this happened. It wasn't like I was still a little kid. So it really did set me up for a lifelong phobia of doctors and nurses and anything medical. And so what I want you to all remember when you walk into any patient's room is that there's always a scared kid inside everybody. Everybody has some event that you're reminding them, that they can be reminded of, that is scary for them. A little bit about me, and I know Dr. Sharon mentioned this, and I am still a marine biologist. I've wanted to be one since I was a little kid. A couple of obstacles that I had is that I grew up in Wisconsin, and I wanted to study, whales and dolphins, and there are no whales and dolphins in Wisconsin. So I moved out to California for grad school and went to San Francisco State studying marine mammals there. And what I discovered when I was out there was that I get seasick. So here we go, somebody from Wisconsin who gets seasick. I can't really work on a boat. So I went into teaching. And I didn't set out for teaching, but teaching was great. It became my calling. I love teaching. I loved, seeing a light bulb pop up over a student's head, which some of you can probably relate to. But I love teaching. And as a professor, I was able to incorporate whales and dolphins into everything that I did. They have a heart, they have lungs, so every example that I gave about the circulatory system was about whales and dolphins, so I just incorporated that into everything. I also started a local chapter of a whale conservation group. I was a naturalist on an Alaskan cruise, and being a biology professor, I was invited to give talks around the community. So everything was going pretty well. I was a single mom of 2 beautiful, wonderful, talented, they're not here. I have 2 kids. So I'm a single mom of 2 kids. And everything was going pretty well. And then April of 2006, I started getting dizzy and nauseous. And I knew that it wasn't right to be getting dizzy. So I went to my doctor, my primary care physician, and I said, "Doctor, I'm dizzy." And he said, "Sherry, you have vertigo." And I said, being a biologist, I kind of knew what vertigo meant. Vertigo means dizzy. So basically, I went to my doctor. I said, "Doctor, I'm dizzy." He said, "Sherry," kind of patting me on the head, "you're dizzy." I'm like, "Oh, thank you. That's very helpful." So come the next month in May, I was getting even more dizzy, and I was starting to get really nauseous and throwing up a lot. Went back to my doctor, again said, I am dizzy. He said, "You have vertigo." I said, "Thank you, goodbye." he called it benign non-positional vertigo. This still means dizzy. So June, I was starting a summer program where I worked at Skyline College, and I was still getting dizzy and throwing up every day, to the point that I said to my doctor, "This isn't right. I'm not pregnant. There's no reason for me to be throwing up every day." And I really insisted that they do something. So in July, on July 1st, I was sent for a referral to an ENT. And the ENT did a very simple hearing test with the tuning fork. You guys familiar with that? I've always used the tuning fork to demonstrate how dolphins hear, because they hear through the bones too. So it was interesting that they used it for like a different reason. But they did a very simple hearing test and noticed that my hearing was different on my hearing loss. I had more hearing loss on my left side than my right side. So they said there's a very rare tumor that we would want to rule it out. So they sent me for an MRI. Now this I remember very, very clearly. On July 5th, I went for my MRI. My MRI was at 4 p.m. Before my MRI, they said, when you're done, go home. We'll call you in a few days with the results. Immediately afterwards, so this is at 5 p.m. on July 5th, they said, wait here, we're going to print all your films, and you're going to take them with you. Yes, this is when they printed films. So you're going to print all your films. Well, that drastic change in attitude was pretty noticeable. It didn't take a brain surgeon to realize something was going on. Sure enough, the next morning, my ENT called me. You're not supposed to say it yet. See if I can go backwards. You saw it already, but my ENT, I think the suspense was over in the introduction. My ENT called me the next morning and wanted to see me right away. So again, what's up? Well, even I, in my untrained eye, could notice that there's something wrong on this x-ray. And I'm assuming everybody in here sees it. If you don't, that big golf ball in my head is not supposed to be there. That's a tumor. So it's a pretty large tumor. It was acoustic neuroma. It was 25 millimeters by 35 millimeters. Sometimes I say centimeters and nobody believes me. But it was a pretty large tumor, so it really did have to come out. There weren't many other options. And I was having a lot of symptoms. My symptoms were getting worse every day. So on July 10th, I went for a meeting with an ENT surgeon. And, we just talked about the options of pretty much how to take it out, not whether it should come out. But I knew that it had to come out. Things that this doctor told me and that everything that I read confirmed was that it was a really good prognosis, an acoustic neuroma. Somebody actually said to me, if you have to have a brain tumor, that's the kind to have. My question to that is, okay, but why do I have to have a brain tumor? That part didn't really make sense. But it was supposed to be an excellent prognosis. I was going to be in the hospital for 5 to 10 days. My kids, who were 12 and 8 at the time, were going to be fine. I was going to have somebody come stay with them at the house for a few days, and then I'd be home. I was planning on being back to work in August. This was a July surgery. So I didn't have any reason to think there was anything other than, routine brain surgery. Now, that phrase should sound odd to you guys. Routine brain surgery? Like, I know that it's routine to you, but it's not routine to the person whose skull you're about to cut open. So routine brain surgery should not be a thing that you mentioned. But it was supposed to go well. My surgery was on July 26, 2006, and obviously something went wrong, most probably a stroke, and instead of 5 to 10 days in the hospital, I spent about 246 days in the hospital. And I finally came home at the end of March 2007. Couple things I want to talk about while I was in the hospital. First of all, I ended up being in ICU for about 3.5 weeks because I could not breathe. Every time I was extubated, I couldn't breathe and they had to intubate me again. So the solution to that was to do a tracheotomy. So when I was in the hallway waiting for my tracheotomy surgery, and picture I couldn't breathe, I couldn't talk, I couldn't communicate, but I could hear everything. So in case you're ever wondering if a patient can hear you when they can't respond back, the answer is yes. They can hear you, they can understand you, they might even write a book about it someday. So make sure that you know that. Every word you say is potentially understood and followed through on. What the doctor said to me when I was sitting there waiting for my tracheotomy surgery was, oh, don't worry about a scar, because Catherine Zeta-Jones had a tracheotomy when she was a kid, and you can't see her scar. Well, this is Catherine Zeta-Jones's neck. And first, this doesn't work on it. First of all, you can't see the scar, but more importantly, I couldn't breathe. I couldn't talk. I couldn't move. A scar from a tracheotomy was the last thing that I was worried about. So I was not worried about a scar. After I had the trach tube put in, nobody really taught me how to breathe with it. You know, if you've ever breathed through a snorkel, you have to breathe a little bit differently, a little bit. You can't breathe in panic. And obviously my whole life at that point was a panic. So I breathed the wrong way, and my trach tube got very wet inside, and I sounded a little bit like this. Can you guys all hear that? There we go. In case you're wondering who that is, this is what I sounded like when I was breathing through the trach tube. So obviously that's not going to ease my fears and make me feel better about life when I'm breathing, sounding like that, and feeling like that as I'm breathing. Another event that happened while I was in the hospital that I do want you guys to be aware of is doctors would come in almost every day and do tests. And as far as I knew, the tests had no reason. I was never told why these tests were necessary. These tests were painful. I would ask, you know, my favorite medical professional, the nurse who brought me morphine, for extra morphine before a doctor was going to come in, because I knew that the test was going to be painful. I was never told what was going on. I would have injections. I had an IV, but I would have injections. You know, and I had no idea what was in the injection or what it was for. One point I remember I had insulin injected, and I was thinking, what, I'm diabetic now? You know, again, I couldn't talk, I couldn't move, I couldn't communicate, but I heard that I had insulin injected. I heard, you know, felt that they were doing these really painful tests. So doctors came in and did painful tests without telling me why, and then left. And one time what the doctor said, jokingly, look, it's like we were never here. Because they did this test that was really painful and left me in a really uncomfortable position, assuming that the nurses would come right in afterwards to make me comfortable again. Well, the nurses didn't respond very quickly. So I was just left in this uncomfortable position, like we were never here. So my question to you is, can he get away with that? You know, pretend like you were never here. At this point, when, you know, I just had different tests every day and different injections all the time, I started to feel like I was Humpty Dumpty. And there was something that was wrong, and everybody in the hospital was trying to put me back together. One thing they made me do is sit in a chair. I think it was called the neuro chair. In any case, it was a chair that was supposed to prop me up a little bit, and all that they told me was that it was to rebuild my strength. And they made me sit in this chair for 2 hours at a time. After 2 minutes, it hurt, intolerably hurt, and they would leave me there for 2 hours. So again, I really did feel like Humpty Dumpty, and I was kind of falling into an abyss. And what happens to Humpty Dumpty when he hits the bottom? Now, how could you avoid having your patients feel like Humpty Dumpty? And it does start with that very first connection. When they first come into and when you first meet them, and anyway, you need to make a connection with them. And that first connection is so important, because that first connection establishes your relationship with them, and it establishes that you have an attitude of empathy. And you always need to display this attitude of empathy. One other story that I want to tell you is when I went to an urgent care center, because when I first came home from the hospital, I could walk with a walker, but being, you know, who I am, I left my walker and went to walk on my own a lot. I remember that my friend, who's here today with me, would be in the living room and I'd be in the kitchen, kind of pushing my walker away, and she's like, Sherry, what are you doing? You need to be careful. So I was pretty adventurous, but I fell a lot. And one time when I fell, I had a pretty big bruise on my leg. And I couldn't feel, it didn't really hurt that much because I can't feel that much pain on one side of my body. But I went to an urgent care center just to see if it was normal to have a huge bruise that then looks like paint pouring down your leg. All I wanted to know was, is this normal or am I going to die? That's all. One simple question. Well, I went to an urgent care center. They didn't take any kind of medical history. They didn't know anything about me. So I went back into the room. The doctor came in. My kids were with me because they were actually helping me to walk. So my kids were with me in the room. The doctor asked me if when I fell, I hit my head. And that's why I'm, and he was wondering if that's why my gait was so off. It was because I hit my head when I fell. My kids burst out laughing. They had started laughing, cracking up. When he continued to ask about my head being injured when I fell, they were laughing so hard they were practically rolling on the floor. The doctor kicked them out of the room, which you might want to do if little kids are in there laughing uncontrollably, but they had a reason for laughing. The doctor had no idea that I had a brain tumor and that I had been in the hospital and that I had had a stroke. He never asked. All he asked was if I was injured when I fell. He wanted me to get x-rays. So he kicked the kids out of the room. When we were done and we finished it he suggested I go get x-rays, as a lot of doctors do, and he left me in the room to make my way out to the waiting room by myself. Well, so in essence, he had kicked out my helpers and left me alone. So I made my way out to the waiting room by holding onto the wall and just walking. But, that really didn't show very much empathy, to not even be aware that I had something going on besides the fall. So what can you give them to show them that you do have empathy? One of the things that I craved most in those 246 days in the hospital was just human, non-medical touch. So just somebody touching me on my shoulder. I used to have my friends give me massages just because you wanted some touch that wasn't just hold your arm out so I can stick a needle in. You wanted some non-medical human touch. Also, another thing, a really important thing to do is always explain what you're doing as you go. You guys are doing some pretty invasive growth. Are you guys all ENTs? Yes, you guys do some pretty invasive growth stuff to people. So you got, and usually it's to help them, right? It's not just to get your jolly, it's not just for fun, it's to help them. Well, tell them that. Don't assume that they know that you're there to help them. Tell them in a soothing voice you're there to help them. Also, there's nothing wrong. I know you don't have a lot of time when you go in to see a patient. There's nothing wrong with tapping them on the shoulder. Like, I'm going to stick this tube up your nose, but first I'm going to tap you on the shoulder to make you feel good. Because if they like you, they're much more likely to cooperate with you. Treating your patients as people and not just patients is going to make them want to help you to help them. And it's going to infuse this attitude of cooperation. Another thing that's really important to know about this whole cooperation thing, you guys have all worked really hard to get to where you are, right? You worked really hard to be the one in that patient's room. You're there because you want to be there. Your patient is not. They're there because they have to be there. They may not know why they're there. They may not understand why they're there. All they know is that they're in a lot of pain, they're uncomfortable, and this person who's happy to be there is coming to stick a tube up their nose. Well, they don't want to be there. So it's like doing a project with that kid in school who doesn't want to be doing the project, but you're really into it. So how do you get cooperation on both sides? Doing all of the things that I mentioned up here is how you're going to get that cooperation. So you have to, but also just keeping in the back of your mind that you're trying to get cooperation from somebody who does not want to cooperate with you. Because they didn't sign up for this. They don't want to be in the hospital. They had enough of hospitals. They might have been in the hospital as a kid, and they really don't want to be there. They're afraid of you. They're afraid of you, and you're trying to get them to cooperate when you do bad things to them. So keep that, if that's in the back of your mind, your attitude will reflect, your actions will reflect that attitude. So if you have that attitude of empathy, all of your actions will reflect that attitude. And you will gain that cooperation. The other thing that's really important to get a take on immediately when you walk into a patient's room is what motivates them. There's always something that's going to be motivating them. For me, every time somebody walked into my room, they saw this note on the nurse's board where they put their notes, and they saw an open can of chocolate frosting on my bedside table. I couldn't eat, I couldn't swallow, but I could smell it. People would bring me like new cans when they thought that the old can lost all of its smell. So they would open cans of chocolate frosting and let me smell it. So, just by that, you say, oh, she likes chocolate. And that's some kind of personal connection that you can make right away. And you're in a hospital, so maybe they don't have a lot of personal things around, but in 246